We embraced the Harwood model of turning outward. So it's become part of our culture in our organization to go out and have community conversations and to talk to the people that we're trying to help with our investments and with our programs. And over again, we heard from community members that the way that we had sort of artificially segmented education, income, and health, and we would make those motions of the silos of education, income, and health. Those were very artificial to them. And when we talked to community members, they said things like, my family is struggling to make ends meet and we can't put healthy food on the table. And I'm working 2 jobs and taking the bus, which means I don't have time to help my kids with their homework. So is that an education issue because my child's struggling in school? Is that an income issue because we can't make ends meet? Is that a health issue because we can't have healthy food on the table? And so their lives, their problems, the things that we were trying to help them with didn't fit in one of our neat little boxes. And so that was our first indication that we really needed to think about our work in the way that people were experiencing it in the community. In addition, we had vision councils that each separately experts who came together on each topic. So in education, we had early childhood providers, we had teachers, we had principals, we had researchers, we had all different folks coming together, and they were saying, how should we invest in education? And then separately, we had people talking about how we should invest in health or in income. And when we would get a proposal, some of our partners in the community were a little ahead of us and said they'd like to address what I described, that family that's spanning across all of these issues. And our funding mechanisms and our ways of investing in the community weren't positioned to be able to support a proposal like that, because we needed to just pick one piece of it and each fund separately. So that's when integration became sort of a must do. We had to do it if we were going to continue to be relevant. And at the same time, we knew that through United Way Worldwide and Robert Wood Johnson, they were looking at how do these things really play into one another. So rather than them being these silos, how are they integrated in a way that really wraps around a family or an individual? So as we looked at our Venn diagram, and here in San Diego, we put together the key places we were working in education, income, and health. We don't necessarily have a specific entry point per se, but we are putting education at the center. So our board actually has gone through a strategic planning process, and we just have a new mission and vision as of April. And what we've looked at is putting education front and center, that the work that we're doing, ultimately, we want to improve children's lives. And we're looking at readiness for kindergarten and early grade literacy. But we're doing that through the lens of family stability and health. So looking at what are those family stability and wellness factors that impede or support a child's academic success. So for example, when you look at attendance, we're looking at how do health factors impact a child's attendance, or how does the family's ability to stay stable in a home from one home to the next or have reliable transportation impact that child's attendance. So in our earliest work, we've been looking at specific neighborhoods and even smaller feeder patterns, so schools that all feed into one high school. And what we've done is use the collective impact model as our framework. And we've established a cradle to career continuum all along the way, all the steps that the child and the family need in order to be successful. So often what we first use as the identification is a child that's struggling, that's been flagged for chronic attendance issues, behavior issues, or issues with their grades. And then we look at their family and say, what's going on in the home that's causing this child to have poor academic performance. Often then what we look for is the families that are what we consider working hard but falling short. So different than the federal poverty level, because we want to cast our net a little bit wider. We're looking at where is the child struggling, and then where is the family low to middle income but struggling to make ends meet. So that working hard but falling short population has seemed to be a key population for us as we identify groups to work with and to target. Our hypothesis is that if a child is struggling academically, there's something going on in the home, and that United Way is uniquely situated to address those issues in the home. We want to do everything we can outside of the classroom so that when the child gets to the classroom, they're ready to learn and they'll exceed. So in our Venn diagram, we've identified in education that attendance is really at the center of all of the issues. That's where we think family stability and health and education all intersect and are sort of prominent is in the attendance issues in the community. We also see issues in education and family stability around mobility. So a family that isn't financially stable tends to move a lot, which impacts the child because they're changing schools and losing some of that coursework and that continuity. And then in the health arena, we see overlap between health and education with the social, emotional, and developmental needs that oftentimes aren't necessarily screened for because the school is focused on academics, rightfully so. But we know that there are a lot of social, emotional things that can influence a child. In the earlier years, those may look different than in the later years. So in the 0 to 5 space, it may be about developmental health and how kids are developing. But in the middle school, it may be more about bullying or body image and how are those things impacting a child's ability to learn. So in our education efforts, we're looking really at how do we empower parents with education and resources. Consistent assessment tools, because that's been one of the challenges. Here in San Diego County, we have 42 school districts, and they all use different assessments for readiness for kindergarten, which I know many other communities can relate to. And so the Common Core will help us in kind of standardizing some of that. But there are some things outside of that, particularly in the early education space, that we don't have consistent metrics for. Access to quality and affordable preschool and childcare is really important. And that, again, is an intersection between education and income, because what individuals can afford it may be different than the quality that they would like for their child. Our partners are really varied. So we have the superintendents, our key partners, obviously administration, parents, teachers, even students are very key in the work that we're doing. Our nonprofit partners who can deliver direct service and that service delivery piece. We've also been working very closely with the County Health and Human Services Department. We've worked with our local universities to have interns. So we have some social work interns that are placed at the school to be able to work with the families of children who are chronically absent. And then the County Child Welfare Service Department provides the clinical supervision for those students so that their coursework can be counted toward their degree. So they're Masters of Social Work students. So that's been a really unique partnership. We also have the local police department for both probation as well as juvenile justice and looking at restorative justice, gang prevention, and what are ways that we can get them involved in after-school activities and things. The city, the Parks and Rec department is involved, again, for that after-school multi-use of fields or parks, lighting, all of those kinds of infrastructure things that can really benefit a community and allow them to access additional resources. Data and evaluation partners have been really important because we want to make sure that we are looking at what is working and what's not working and how do we continuously improve what we've been doing as a collective. And that is a new muscle for, I think, many people at the table. The rigor with which we need to evaluate and analyze our work is new, and it's not something that our United Way and nonprofits in our community have typically invested in. We used to think about money that went to evaluation as money that doesn't go into the community. And what we're now seeing is that if we want to invest in the community in the most effective and efficient way, we have to do the research and evaluation to know what works. We're working on getting business to the table because we know that that's really critical, particularly in the high school space, where we want education to be linked to employers' needs. So, it's really about readiness on this whole continuum of readiness. And that when the high school graduates a student and says they're ready, they're job ready or career ready, we want the employer on the other end to have that same definition of readiness and to co-create some of those curriculums and those soft skill developments so that we know that readiness means the same thing on both sides of that graduation mark. So we, in addition to integrating education, income, and health, we've also been using the collective impact framework. And we think of our role in the community in two ways. United Way, in some instances, is the backbone of certain initiatives in the community, meaning we are the anchor entity. We're doing the convening, the facilitating, the data measurement, the communications, and we're responsible for all of that, much more hands-on and direct contact with the efforts. At the same time, where we had previously given programmatic grants or safety net funding out into the community through the money that we're able to raise, instead of doing that safety net or programmatic funding, we're investing in the capacity of our community to implement collective impact. So in our most recent request for proposals in our RFP, we asked for groups of entities to come together in what we're calling impact networks, where we could actually provide not only dollars, but United Way staff to facilitate these entities coming together around a common goal that leads to the readiness for kindergarten and early grade literacy. So our funding is a grant, but it's also United Way lessons learned and expertise that we're giving in terms of a staff person to facilitate, as well as third-party evaluation. So we can look at that continuous improvement and continue to learn from our partners in the community. So we've really, there's places where we're the backbone and places where we're investing in capacity in the community, but we're investing in a much different way than we ever have before. It's not just about outcomes, but we're measuring the programmatic progress as well as the progress toward a more comprehensive collective impact initiative. So we're looking at how did collective impact help to accelerate the outcomes? How did working together in this collective way really accelerate the end outcomes that we wouldn't have seen happen as quickly if it was just individual funding to separate agencies?